And he's like, I have every intention to travel to every country, but I will never step foot in America. Even if they pay me to go there, I will never go there because of what they've done here. I will say Israel did an amazing job, an excellent job at eradicating all infrastructure. Like, it was so well done. It literally looks like what you would imagine a nuclear bomb would do, just a post-apocalyptic scene. That's what you see in Gaza. It really is like that. The ceasefire went into place a few weeks ago. When I was there these past 3 weeks, we were hearing bombing. In June, it was every 20 minutes, and maybe this time it was every hour. They're bombing any infrastructure, any raised structure, any home in the red area that they're occupied, the 55% of Gaza. That said, I as a physician, I as a doctor, have every right to explain to people what I saw with my own eyes and label it a genocide. My name is Aziz Rahman. I'm one of the interventional radiologists here in Milwaukee, and I've been practicing for about 7 years now. Born and raised in Massachusetts, and very grateful to have given the opportunity to go to Gaza twice now, alhamdulillah. So I grew up in Boston. My parents are Indian, they're from Hyderabad, and grew up in a pretty religious environment. We practiced our faith. I was actually the only Muslim in my school, my high school, pretty much the only colored person in my school, so I was a token brown guy, and went to Missouri for medical school, undergraduate medical school as a combined program, and there was a lot of colored people in the medical school, so it was very different for me, and there was a lot of Muslims there too, so it kind of helped my identity. You know, at the end of the day, I'm a 9/11 Muslim. We grew up in the generation of 9/11, so we were always kind of quietist, and we were taught not to talk too much about your religion, and just it's better to be quiet than speak up. And so, you know, that was in 8th grade when 9/11 happened. And so when I went to college and we were surrounded by Muslims, it kind of gave me more confidence. It showed me that I didn't really have to be silent. There's power in numbers. And I think that helped gain some of my confidence back, you know, just to be more forthcoming with my prayers and telling my bosses at work, hey, I need some time off for prayer, for Friday prayer. And actually what I realized is by being more open, people actually respected you more, you know, and we all know this as a principle. It's like the more principled you are, the more people respect you for having principles. And so that's something that I think really affected me. I was actually at Masjid al-Aqsa this past Ramadan this year, and you know, one of the reasons I went there is because I just felt so guilty watching what's going on in Gaza. So the next best thing to me was, let's go to Aqsa and just support the people who are being oppressed there. And you know, we as Americans and people from the West, whether it be the UK or South Africa, Australians, we have the ability to go there. And I knew some other Americans that were going, so tagged along with them. And it was nice. You know, we saw the locals, we prayed with them, we ate, we broke our fast with them. And they basically took us in as family. They were asking us if we're okay, if we're taking care of making sure we're eating properly at, you know, morning and evening. And it was just really beautiful, you know. And I got really close to the sheikh there at the mosque, and I asked him, like, hey, I want to help the people in Gaza. Like, I really want to do more with my hands and help. And so, you know, he basically said, just pray to God and a way will be made, basically. And, you know, that's generic advice that any sheikh gives you, but, you know, on Laylatul Qadr there, on the 27th night in Ramadan at Masjid al-Aqsa, I made dua, you know, give me a way to help the people of Gaza. And nothing magical happened. But 2 weeks later, I was back home, and I had this dream where I was at the mosque, and I was a doctor there, and all I could see is injured people on the ground in the masjid, and I was like confused. A week later, I get an invitation to go to Gaza, subhanAllah, and it was random. I hadn't applied. A friend had reached out on my behalf and asked on my behalf, and that's how I was invited, subhanAllah. And so when I came, I was in disbelief. I was like, this can't be real. But eventually I realized it was indeed real. Dr. Zaidi, he's an orthopedic surgeon. I went to medical school with him, and he had been to Gaza twice already. And I would always complain to him that, hey, I'm an interventional radiologist. I don't know what I can do in Gaza. I don't know what infrastructure they have there, but I have every dream to go to Gaza and help the people in any capacity I can. I'll be a nurse. I'll be a ER physician. I'll be anything. Like just if you have a way, just let me know if you have a way, you know? And so he knew, there's some people who kind of just say things, and then there's some people who persist. I was one of those guys, like just annoying him about it, you know? And sometimes I would say, hey, sorry to bother you, if you know, any updates, question mark, you know? And so I don't know what happened behind the scenes, but the prayers I asked in Aqsa somehow were answered, such that there was a open position for a physician last minute because someone dropped out. And so when someone drops out, it's almost like we need to fill the spot as soon as possible because there are deadlines that they have to meet. And so I got lucky and that they approved me. Yeah, so when I say they approved me, I say the organization from America approved me. Okay, so the approval process to actually get into Gaza is a whole intricate, complicated process that has about 65 to 75% rejection rate the night before. So you have to fly to Amman the day before your entry, okay? And then about anywhere from 10 to 12 hours before you're supposed to actually go in. So you're supposed to go in at 7 a.m., then maybe at 10 p.m. the night before you get this document stating you're either approved or rejected. So you get a green or a red. So if you're red, you go back home. But if you're green, then you have the ability to now go through the Jordanian checkpoint, then you go through the Israeli checkpoint and customs. So at this point is another process by which you can get denied. So on my last trip 3 weeks ago, 2 of my colleagues were denied. One was from Texas and one was from Canada. And they were denied at the customs. So like just steps away from the bus that goes to Gaza. And so then you get on the bus if you're past the customs, and that takes about 3 hours to actually drive through occupied Palestine into Gaza. And then once you enter Gaza, it's like this enormous military checkpoint. You see the tanks, you see the soldiers, you see the people responsible for the genocide, and it just causes so much pain in your heart. You're seeing that walking through the gates that, you know, secure Gaza, and it's just so dystopian. It's so dystopian. And then there's another bus that takes you to the hospital. It takes about 2 hours from there. I was at Nasser Hospital, but when I was there, I would make day trips to Al-Aqsa Hospital, which is in Dar al-Balah, and then Al-Shifa Hospital in Gaza, which is a nightmare to look at. It was one of the most advanced hospitals in Gaza, and it was actually a very reputable hospital. It had all the specialties, research, everything, and it's just a shell. I mean, it's eradicated. It's every patient bed, every patient room has been systemically destroyed. And it's said that there's hundreds of patients still under the rubble because they haven't allowed heavy equipment in. Yeah, so when I first went in, it was June 2025, and things were getting significantly worse in Gaza. People were starving. We were starting to hear about famine, and the killing has not stopped at this point. I had this decision I had to make, whether I would leave my family behind and go. And I didn't know what to do. So I asked many doctors who had gone before, you know, what's the best thing to do here? And so you had some pragmatists saying it's not worth going. And then you had some people who are a little bit more, you know, understanding of the spiritual aspect of it, saying you can help other people in other ways. And so at the end, I decided, after talking to my family, my mom, my wife, that I was going to go. And to be honest with you, it was scary. I made a will before I left. You know, did all the things I would need to do in case I didn't come back. Made sure my family had everything they needed. And wrote letters to my kids and told them not to open them, tell them in Gaza. And, you know, just anything that you would imagine you would do before you left for good, you know. Saying the last goodbyes, just in case. And then saying another goodbye after that. And then when you get there, it's still scary. You're relieved, but then you start hearing bombs. I've never been in a war zone, so to hear bombs going off 200 meters in the distance was scary, and it shakes not only your eardrums but your soul, and you just wonder how many people just died, and that's painful to think about. And then you go downstairs into the emergency department and you see children and women and people wailing and screaming and gore and people's arms blown off and someone carrying someone's leg inside, and you're just like, where am I? And then you realize you're in Gaza, and this is the social media accounts have been showing you this for the last 2 years, but you just happen to be there and you're seeing it with your own eyes. And then you wonder, like, how am I not just breaking down and crying right now? And then you realize, because you're a doctor and all your life you've been trained, just do, it's time to do. And you just run to the next patient, say, what does this guy need? And then you run to the next patient, and you say, what does she need? And it's just constant. And in June, it literally was constant. It would be what we called mass casualty incidents, where we would have in 4 hours, maybe 500 patients come through the emergency department, which is unheard of. And they wouldn't just be like simple injuries. It would be, multi-trauma, multi-faceted trauma, whether it be head, eyes, chest, heart, lung, legs, extremities, and that's just one patient. That should take an hour to stabilize, but we have like 5 minutes to stabilize that patient until the next patient, the next child. And then you're constantly having to move patients into triage situations where some patients you're just saying, okay, you're gonna die, so go to this room and die off with your family. Okay, you have a little chance of living, we don't have the resources, so unfortunately you have to die as well. Okay, you can handle maybe a surgery, let's ask the neurosurgeon if he can do the surgery. And it's just that kind of triage, and it's happening within maybe seconds to minutes. And it's just constant, And June was truly a nightmare. And it got worse in July, August, September. And now that we have the ceasefire, I just came in. It's not, the bombing has stopped and the genocide continues in other ways. In fact, I talked to the local Gazans and they're very happy that the bombing has stopped, but they said, Dr. Aziz, I'm telling you, we're still in the genocide. We're not getting enough food. Winter's coming, we don't have tents. We don't have any medications. Medical supplies are being banned. And so this is civilian infrastructure, civilian resources that's being intentionally, deliberately banned from coming in. And so even though the direct killing, I should say, has stopped, there is an indirect process of killing. Cancer rates are on the rise. They're not allowing certain chemotherapies and radiation therapies. That should be basic, part of the treatment algorithm for any cancer. Leaving Gaza for medical treatment is a whole ordeal. It's not guaranteed. There's 13,000 people on the wait list, and they rank them, category A, B, and C. And category A is like imminent death, and they're lucky if they get out. And so I have very sad stories from Gaza where we're hoping for someone to be transferred out of Gaza for medical treatment, but it just takes too long. Some patients die in the process. Some patients die in the process of being transited because they had to become a category A essentially at this point to be sick enough to be approved to be transferred. And at that point, sometimes it's just too late. I remember talking to this one medical student, and he was excited about the ceasefire, and he's like, I just want to leave and finish my education and see the world. And he's like, I have every intention to travel to every country, but I will never step foot in America. Even if they pay me to go there, I will never go there because of what they've done here. The bombs that you see here are not just Israeli bombs, they're American bombs. And you know what? This time I got to leave the hospital because of the ceasefire, and I got to see the rubble, the destruction. And the way I will describe it is, I will say Israel did an amazing job, an excellent job at eradicating all infrastructure. Like, it was so well done. You're just looking around you and everything's destroyed. It literally looks like what you would imagine a nuclear bomb would do, just a post-apocalyptic scene. Just imagine a movie where this post-apocalyptic scene, that's what you see in Gaza. It really is like that. And you just realize, like, why every house? Why every school? Why 900 mosques? Why churches? Why everything? Why the water sanitation area? Why the sewage disposal area? Why the food distribution area? It's just like so well done. And you realize, okay, I know why. Because it was intentional. Because it was a genocide. Because they were trying to eradicate the Palestinian people from Gaza, you know? And so it all makes sense when you remember that's why it happened. And it's so hard to understand. I was there for 3 weeks, and every single time we left the hospital, I would take a picture of the same scene. And now I review my pictures, and I'm just like, why did I take 100 pictures of rubble? Because that's all there is to take a picture of, you know? And I just wanted to document it so I can share it with the world. But then I just realized, like, no one can tell the difference between this picture of rubble versus that picture of rubble. It's just rubble. As we're driving by, sometimes we see what is like multi-story apartments, and each floor had a concrete layer. And you just see like 8 concrete layers stacked on top of each other like a sandwich. And that is because when the bomb came, it just all fell. And now you see 8 floors. And as we're driving by, my driver was like, there's a known family under there. And they still haven't been taken out. And I was like, how do you know? Like, everyone knows that that family didn't refuse to leave when they were told to evacuate. And you hear many stories like that. You hear people in the restaurants who refuse to leave their business because, you know, that's part of their resistance. And they're still under the rubble. If someone came into Nasser Hospital and we happened to save their life, and they have a life-saving surgery, and then they go home to their tent, and then they get an infection and die, that doesn't count towards the death toll. And that's just a story that happens too often, you know. And let's say that accounts for another 10,000, you know, over the last 2 years. You can come up with all sorts of, you know, different situations, and just the reality, that's the truth. And so the fact that no international journalists have been allowed into Gaza is intentional, because we are physicians. We're not trained in documentation that journalists are trained in. So when we go out there and we see what's happening outside the hospital, and sometimes even in the hospital, like at Shifa Hospital, we don't even know what to do. And so one thing I realize is I'm just going to speak out as much as I can. I'm not a professional journalist. I'm not a professional, you know, in that regard, but I think I'm the only one who can do it. And me and the other nurses and doctors and healthcare workers that have been, we're the only ones who can speak up. And I can't tell you how many times I wake up with my phone and look at my text message, and it's a friend that I made in Gaza, and they say, hey, thank you so much for speaking up. I saw your post, and I'm so honored to have met you, and I'm so happy that you came here and you saw our plight and that you're speaking up on our behalf. And that gives me energy, honestly. It's not about me. It's not about being noticed. But when you get glad tidings from the oppressed, the people who have been oppressed, I'm telling you, man, it's like dopamine release. It feels good, and it keeps me going, to be honest with you. You don't understand. Those guys deserve everything. There's so many times I just wish I could give them more, you know? Maybe I had one chocolate to give to this kid, and I just wanted to just give him everything. But then you realize you have nothing with you in Gaza. So you can't. You have everything back home. You have money, you have cars, you have this, you have every blessing you have. You can order something on Amazon, 2-hour delivery. But when you're in Gaza, you can't even give this guy more than one piece of small candy because you weren't allowed to bring more than a bag that has your belongings, that has your clothes. If you bring anything medical, they confiscate it. You can't bring too much food nowadays because they get suspicious. You can't bring in baby formula, they confiscate that. It's just like, what can I do? And then you realize your job is not there to save people medically. It's not to distribute food. It's just to be an advocate, a witness, and come back and tell their story. And that's what I'm trying to do. So let me explain this. So in June, as I left, it was very depressing. I actually, half my heart didn't want to come back. It's just like so depressing. But the other half of my heart was like, I have to come back and help these people in the little way I can, whether it be through advocacy or medicine. And so I made the intention as I was leaving Gaza in June, maybe I'll come back in October. That's my next vacation. And then as of September, I had secured a spot to come to Gaza with an organization based in Michigan. And then that organization happened to get banned by Israel from any future mission. So I was like, oh man, I have this vacation time in October. Unfortunately, I lost the opportunity to go to Gaza. I was kind of bummed. And then this other opportunity came up. Same situation, someone dropped out last minute. They need to fill a spot. We're on this Telegram group with all different doctors that have been to Gaza in the past 2 years. And so they put it out there. So I immediately messaged the CEO of Heroic Hearts, and he calls me back, and someone put a good referral in, Dr. Farhan Aziz from Texas, and he put in a good word for me, and I was approved to go again. And I was like, that is not coincidental. That is not random. That is because Allah, my Lord, knew that I really wanted to go. And like I said, even then, 2 of my colleagues were denied, steps away from the possibility of going to Gaza. So it's really not our doing that we go. We just make the effort, and if we're meant to go or if we're meant to do good, then it'll happen. The situation on the ground varies drastically from June to November. In June, all I can remember is death, gore, guts, blood, limbs, children, women. That's really all I can remember. Weight loss, anemia, lack of vitamins. People's skin color was changing because there's no energy, there's no nutrition. People lost 20 kilograms on average. There was no food. I lost 11 to 15 pounds in my 2 weeks there. People were fainting in the hospital, like doctors and nurses and medical students. That's what I remember of June. November, it was like 180 degrees. This ceasefire is good for the people in that there's no bombing. So people feel comfortable going out to get food now. There is some aid coming in, but only 23% of the trucks that's supposed to be coming in are actually coming in. So the people with jobs, which is obviously very few, have an income to afford this food coming in. But the people who don't have jobs, who don't have any income, there's no food for them. So they're completely reliant on the free aid that's coming in. But Israel's blocking 75% of the trucks. There's 2 million people in Gaza. So you can do the math. It doesn't add up. There's no way the majority of Gazans are getting food. And what you'll see on social media are shops full of snacks and candies and this and that. And what Israel has been doing is they've been magnifying these shops, stating, oh, we're allowing the aid in. I walked through these grocery stores intentionally to see what kind of stuff they're selling. There's nothing nutritious. Yeah, you have some fruits here and there. You have some meat here and there. But intentionally, it's very little amount. There's hundreds of people waiting for meat, and there's only maybe 10 or 15 people that are going to get it. That ratio, And so when I walk through these grocery stores, I realize it's just like candy, soda. It's just like, where's the nutritious foods? Like, we need protein. And if you're starving a population, you have to worry about refeeding syndrome. You don't just give them more carbs. That can actually be dangerous to them. So the fact that the nutrition is intentionally coming in such a way that it actually exacerbates the health is so intelligent. It's so calculated. It's so genocidal, right? And that's what I saw. So yeah, the situation in terms of death has improved, but trust me, there's going to be other ways of killing the Palestinians. And the other thing I want to talk about, just the healthcare infrastructure is so devastated, so decimated. Supplies are so low. We have to be creative in how we're doing procedures. The ICU, the emergency room, the surgical operating theaters, everyone was complaining of lack of supplies. Orthopedic surgeons who sometimes put the fixator rods in, we're saying that we don't have any more. They have to be creative in how they're fixing broken bones, and it's just incredible to hear every single specialty in medicine in Gaza complaining about lack of supplies, lack of equipment, from the most basic equipment, by the way, to the most more advanced equipment. But it's and cancer rates are on the rise. One, probably because they've been neglected for the last 2 years. They haven't been given the opportunity to come to the hospital. It's been too busy with trauma. And then number 2 is the bombs are not clean. They have toxic, chemicals in them. They leach into the soil. When they explode, they go into the air. The children are breathing them in. The young men are breathing them in. So you can imagine this next generation, there's going to be a huge influx of patients coming to the hospital with cancers, aggressive cancers. And guess what? Those aggressive cancers require aggressive chemotherapy, radiation therapy, surgical equipment, and none of that is going to be offered. So as I'm telling you, you're going to see a huge problem in the next coming years. I think it's starting now. There's about 3 functioning hospitals. Nasser Hospital is like the main hospital with all the specialties. There's Al-Aqsa Hospital, which I wouldn't call a fully functioning hospital. There's Mamadani Hospital. Shifa Hospital is just a sad state. So yeah, there's not that many hospitals left. There's some field hospitals, but they don't really provide much services aside from triage and stabilization. So yeah, the medical system has been just eradicated. It requires a pretty skillful level of evil. That's what it requires. Honestly. I mean, I will praise someone for their qualities when it's deserved. And I will praise the IDF for doing a great job with the genocide. They really thought it out. And they got away with it. That's the reality, is the international community has completely let down the Palestinians, and we all watched on our smartphones, and they had all these conferences and meetings and UN Security Councils and this and that, and at the end of the day, just more people died. And Israel did more damage, and people's homes got destroyed, and now there's not much left. And now they're occupying 55% of Gaza. And there's still a drone surveying everything going on in Gaza. Like, I forgot to mention that. You walk outside, you see the drone. You go to sleep, you hear the drone. Usually they fly at like 30,000 feet. Occasionally they'll drop down to like 15,000 feet. And when it's that low, it's so loud you can't sleep. And it's terrifying because you're just expecting it to be a bomb. Like they're clearly a little bit more aggressive when they're at 15,000. And there's so many nights that I was like, oh man, this is kind of scary. This is like right outside the hospital. And it inspires fear. I remember asking this 5-year-old kid, the father invited me to his tent for dinner, and he had a son. And so I asked the 5-year-old child, I was like, what do you think of that drone? Because all you can hear is a buzz. And he's like, it doesn't scare me, but I'm glad, I just want the drone to stop bombing us. Like he was 3 years old when this all started. So he grew up with a drone. He doesn't know what silence is, when you're in a room and you hear that house fly, like bzzz, and you just like want to get rid of that house fly. He doesn't know what silence is. He's always hearing that hum. In fact, in Gaza, it's so weird. People say if you don't hear the drone, they get really suspicious something's up. It's the strangest phenomenon. And I experienced that. One night I was like, where's the drone? It's so quiet. You're just wondering like, what the hell's going on? I am laughing because it's so strange. But this is the life they live. I mean, all the kids there, kids are any human being's weakness, right? They're beautiful, they're innocent, they deserve everything. And when you see those children in Gaza, man, it's just like, why are they barefoot? Why are they getting infections in their feet because they're walking over syringes and bombs and shrapnel, and then you just see them skinny bones sticking out, and you're like, there's not enough food. And then you see them collecting plastics to try to burn for fuel for their parents and try to make a living. And you just realize the kids are the victims. In Gaza, the average age is very young. 50% are basically younger than 18. And it's terrifying because you see these children having no future. There's no schools. And the schools that did exist are now displacement camps. So which child wants to go to a school? They're going to have PTSD that this was a displacement camp that was bombed multiple times, right? So right now, every now and then, you have this like tent that is a makeshift school, and they don't really teach a curriculum there, but it's just this idea of just getting kids back in a space where they're being taught something. whether it be a song of resistance, whether it be the alphabet, whether it be some math. And you realize the kids love that, because that's what kids are supposed to be doing at that age, right? They're supposed to be going to school, learning. And it's a tragedy, man. Yeah.
Up to you?
Yeah, so I always tell people, like, thank God, and I'm very blessed to be able to say this, like, God hasn't really tested me in a way that has affected my mental health. And even after Gaza, I thought maybe it's not normal to see this, and somehow I still maintain my mental health. And after seeing what I saw in Gaza, I realized the same thing as with the Palestinians. They have seen atrocities that can only be described in history books and in tribunals and in court cases. And I remember hearing this story on this past trip where someone's uncle got bombed while he was in the apartment, and his body got stuck between two concrete floors in the rubble, and his torso and legs were under the rubble, and his chest and head and arms were kind of dangling up. His daughter could not see the scene, but they didn't have the heavy equipment to get the body out. So every single time they walked by, they would just see their dead father, dead uncle, with his top half just hanging out. To the point after like a week, she just couldn't take it anymore. So then this brother basically managed to find some guy who had one of the bulldozers or something, paid him a very hefty payment, money he didn't have, right? That's the point. They don't have money. And so he spent money he didn't have to just lift up the concrete a little bit, just so we can take the body out and bury it. And it's just like, that doesn't make any sense, right? That's an easy story to convey. There's some difficult stories to convey. And more recently, you're hearing these stories about rape coming from these prisoners, and organ harvesting, and signs of torture. And I actually talked to some doctors who were arrested, and they were released on no charges. But the experience they had in jail is just unbelievable. So you realize everyone in Gaza has depression. And the psychological state of the children and the women is terrible. Really. But somehow they still smile and they say, Alhamdulillah, praise be to God for even having life, for being able to get food for the day, for having some shelter for that day, for waking up and being able to say, praise be to God. It's really fascinating. And then you realize that they have a level of faith or belief in God and the hereafter that we all kind of wish we had. And they're the model, in my opinion, of people with faith. They truly have nothing, but they act like they have everything. They have a lot of pride. I remember going there and being invited to so many people's tents for food. And I'm like, you need the food more than I do. I'll go back to America and eat. They're like, no, you are going to come and we're going to feed you. It was a sense of pride, you know. They love to host. Their culture is very beautiful in that they love to host. And a guest is the most important thing for them. And we ate, and then they would bring in some tea. And the host would ask me, can we get you some tea? And I said no, because in my head, I knew what that meant. That would mean, as I'm hanging out with the host, the daughter and the wife would have to leave the tent, start a fire with old furniture or plastic, warm up the dirty water, boil it, then put the tea leaves in, and then offer me the tea. So I said no. I didn't say why, but I just said no. And then the host was like, no, you're our guest. We have to make you tea. And so then I see his wife and daughter leaving the tent. And 45 minutes later, they present us with the tea. And I'm just like, man, the effort and the energy and the resources and the love that they put into me just to have a cup of tea. This is last week.
This is
last week.
I know you're sitting here talking about it.
Yeah, it's incredible. And it was in a tent, by the way. We're sitting on the ground, on the sand, in a tent, at night. It's chilly. But it was beautiful. It was beautiful. And they weren't complaining. They just wanted me to be with them. And again, they're just honored that some guy from across the pond came here, away from his family, just to be with them. It actually kind of makes no sense, right? Why would we do this? It's because humanitarianism speaks very loudly. I don't care about me. You can replace me with anyone, but someone who cares about humans is a true human. It's sad that that's the bar we live at right now, but I think I'm honored I was given the opportunity. But there's so many other people out there that would, that would love this opportunity, and I hope they're given the opportunity. In June, I remember talking to the Palestinians, and I specifically asked them in June, I was like, if there's anything I can bring back to Americans, what can I say? And I said this on my podcast, on Theo Von podcast. I said, number one, they said, we are voiceless, so be our voice. And it's true, if they speak up, they will be monitored, surveilled, and probably killed. And then number two is, we've been dehumanized to the point that people literally forgot that we're human. So remind people that we're human. I remember when I got there, in medicine, they were doing their board examinations. I was like, in the middle of a genocide, you guys are doing your board examinations? And so they wanted me to be part of the teachers, the examiners. And so I was honored, and I said yes, of course. I had some questions prepared. And I was like, should I go easier because you guys are in the middle of a genocide? Maybe the residents and the medical students don't have time to prepare and study as hard. And they're like, no. We expect them to have studied like anyone else in the world. And I was like, that is insane. So I felt guilty as an examiner, like asking the questions that were probably more difficult. But to my surprise, they got the answers right. They clearly study in their tents in the dark with their cell phone light, because there's no electricity in Gaza, by the way. Just an FYI, there's no electricity in Gaza. People are basically, if they're lucky, getting some solar energy. The hospitals run on diesel, and the diesel generators have to change every 6 hours or so. So 4 times in the middle of the day, Nasser Hospital completely goes dark for like a minute. And like ventilators, breathing, everything, every piece of equipment goes dark, ultrasound machines. So, and there's not enough diesel coming in. This is like, people don't understand just because there's a ceasefire doesn't mean everything's solved. There is so many problems with this occupation of Gaza. And the UN and the US, they're not really helping what needs to be helped with. They're just trying to secure the border for Israel. And this is my plea. This is my plea to the US. This is my plea to the UN. This is my plea to the world that 100% of the trucks need to get in. 200% of the trucks need to get in. There needs to be real aid, real food, real security for the people. Winter's coming. It's going to get cold. It's raining. The tents are not waterproof. They need to get real tents in, blankets, winter gear. People need to start reconstructing. There needs to be heavy equipment allowed in so people can actually pick up the rubble. There needs to be scientists that go in. There needs to be journalists that go in. Why is there a ceasefire and these people are not allowed in? Why are journalists not allowed in? The ceasefire went into place a few weeks ago. When I was there these past 3 weeks, we were hearing bombing. In June, it was every 20 minutes, and maybe this time it was every hour. So we were hearing bombing every hour. That said, it wasn't necessarily where the majority of the population is living. It was on the yellow zone. And essentially what they're doing, I asked many people, what are they bombing? They're bombing any infrastructure, any raised structure, any home in the red area that they're occupied, the 55% of Gaza. They're just eradicating everything through bombings. And anyone who even gets close to this arbitrary yellow line, in some places it's demarcated, in some places it's not demarcated, so people kind of go close to it with the hopes that they can go back to their home and get some blankets or some chairs or some furniture or some memories, and then they get bombed. This happened many times. I was in the emergency department and I asked, I heard 5 people just got bombed. And I was like, what? I thought the bombing stopped. And they're like, no, they were trying to go to their area near the yellow zone, and it's not very clear what's the yellow zone, what's not the yellow zone, and the drone dropped a missile. So, no, the deaths are still happening. A ceasefire for the most part, but there's still bombs and death and destruction. I don't know if you recently saw this, Palestinian rights for prisoners report that just came out last week, and I read through it and it was horrifying. And I wanted to share it with my family and friends to spread the message, but it was too much. It was to the point I didn't even want to share it with my wife because it was not human. And the kind of stuff that's happening in those jails, like you said, when we hear about it, we're like, okay, that happened, but how many horrors have happened that no one wants to speak about? To the point, I don't even know if I feel comfortable saying it, but I will, because it's public information now, that it's not even that they torture people through rape using objects and whatnot. They spray chemicals that attract animals to the raping. It's the amount of creativity the Israelis have to torture the Palestinians is unbelievable, and it's beyond human. It's beyond human to treat another human that way. I met 2 doctors that told me about their detentions, and one refused to tell me too much detail because I think he just had too much trauma. He was there in jail for a year. Another guy was in jail for 2 months. By the way, they were both released without charges, obviously. And he was describing the situation such that they were pretty much zip-tied with their arms behind their back for the majority of the day. They were given access to water 1 or 2 hours a day. As a Muslim, you have to pray and do ablution. They had to basically do everything in that 1 or 2 hours. They weren't allowed to talk. They were basically in a giant room with 200 other prisoners, and they weren't allowed to talk to each other. There was scabies and all sorts of skin diseases. Sometimes they were told to stand on this little block in squatting position, and if they fell, they would be beaten up. They were blindfolded for the majority of the day. By the way, these are like the stories that they told me. I'm sure there's so many more horrors that they were too shy too embarrassed to even share. That said, one beautiful story that from these one of these doctors. I said, "How did you get through this process?" And he said it was faith. And I was like, "Okay, I get it, but like, can you tell me a little bit more? Like, how did you extract that faith from yourself?" And he's like, "Well, when I got there, I didn't think I was going to be able to handle it. But then he described that he doesn't know much of the Quran, the holy book. He's like, but I know Surah Yusuf. And Surah Yusuf is the story about him being jailed. And so he kept reciting that, and I gave him some energy, some hope. And it's so beautiful that there was one prisoner in jail who had memorized the whole Quran, a Hafiz. But the prisoners are not allowed to talk to each other. So they would somehow find out a way to memorize different parts of the Quran through this guy during shift change of the prisoners. I mean, just like the amount of patience, and it's just incredible that these guys in middle of jail found a way to communicate with this one guy who was a Hafiz, and they would want to learn from him during shift changes. It's just like incredible. And these are real surgeons and doctors I worked with. This is not some fairy tale. Like, these are real simple people in Gaza who have these stories. Now, witnessing it on your phone is terrifying, to see the gore and the screaming of children. But hearing those shrieks in person pierces your soul, pierces your humanity. Seeing a dead child from a bombing doesn't make sense. Seeing a lifeless child, gray, with blood coming out of their brain, their skull, and brain matter coming out, and seeing their bone coming out of their arms, it doesn't make sense, especially when you have healthy children at home, thank God, and you realize there is evil in this world. And it's hard, man. It's hard to see this stuff in person. It's really not pleasant. It's not that we want to see it. We want it to stop. But social media has a very important role. And I think the people in Gaza recognize that. They don't like taking pictures of dead bodies and corpses and limbs, but the people in the world need to see what's going on, right? So I don't like looking at those images on my phone when I'm back here. Even after seeing it in person, it sucks to see that. But you almost have to, because someone in Gaza is crying out and saying, "Oh world, please look to see what's going on with us." And if you just scroll past it, you're just saying, "Sorry, can't listen to you." To see gore from an explosion is different. From shrapnel is different. I remember before I went in June, I was intentionally watching some of the social media videos of the gore, because I was like, I'm gonna have to see this in person. And if I can't handle it on my phone, then I'm not gonna be able to handle it in real life. And I remember seeing this one video that I would have otherwise just scrolled past because I can't handle that kind of stuff, where this child, this 7-year-old girl, right immediately seconds after a bombing, there's blood gushing out of her brain, and she's talking to someone, and she just dies because she just lost all of her blood. And I went home that day, and I was like, I couldn't even speak. I was like, I don't know if I'm ready for this, I mean, you're not expected in life to be ready for that. So everyone in this world has become selfish, right? Everyone is nationalistic nowadays. Everyone only cares about their own borders. Everyone has a reason to do what they're doing to benefit themselves. To the point that everyone's willing to watch their neighbor go up in flames and be beheaded, literally and figuratively, as long as within their borders, they're fine. Even if they're brothers. And I think it just makes you realize the kind of society we live in nowadays. That we call our Muslim brothers for help, and they're busy with concerts. They're busy with the stock market, making more money as someone in Gaza is just being annihilated. I remember one of the worst days in Gaza was during the Super Bowl. And what are most Muslims doing in America? Watching the Super Bowl. And one of the greatest tragedies is going on in Gaza because Netanyahu knew that the world would be distracted that day. There's so many stories of the Muslims just asleep. When I was in Gaza, people were more upset with the Arabs and the Muslims than Israel and Netanyahu. They said, we expect this from Israel and Netanyahu, but we don't expect this from our Muslim brothers, from our neighbors. I mean, I wish I could go anywhere in the world and help, whether it be Sudan, whether it be China, whether it be the Uyghurs, whether it be in Bangladesh, whether it be in Palestine, right? So it's just, as a human being, you only have so much time and energy, and you just got to dedicate yourself to something. And I just happened to dedicate myself to Palestine after being able to go to Masjid al-Aqsa. But that's not the takeaway from anyone or any effort for humanity, We have to support those people who are oppressed, and no one deserves more attention and support than those people, especially the women and children who have nothing. And right now we obviously are seeing what's going on in Sudan, and it's absolutely horrible, and it's unimaginable, and it's at numbers that don't even make sense. And it's just like, what is going on? The word genocide is a legal term defined by the International Court of Justice, and that is the legal term for people to live by. That said, I as a physician, I as a doctor, have every right to explain to people what I saw with my own eyes and label it a genocide. Am I applying legal theory to that? Absolutely not. But I will say what I saw is absolutely a genocide.
Would you say it was ethnic cleansing?
I would say it was ethnic cleansing. I mean, it's not even me saying that. There's academics like John Mersheimer, who is an absolutely intelligent man from University of Chicago, who lays it out, right? He's saying there are only a couple of options that Israel has for Gaza. One is kill them all. One is displace them all into a different country that's willing to accept. What is that? That's ethnic cleansing, right? The courts can figure this out. It'll take them decades to figure this out. But right now, we don't have decades, right? People are starving to death. People are dying from diseases. People are dying from lack of medical infrastructure. And I'm going to say it as I saw it, right? So my point is, I've given many talks, and I have not received any negative feedback, and I thank God for that, because I'm trying to be as straightforward and objective as I can. And I always tell people, if you disagree with me, let's have a conversation. And the other thing I always say is, you can look at my pictures on my phone. I have thousands of pictures and videos. And it's not just me. Every physician and nurse who has been there has thousands of pictures and videos, right? We are not, I think there was this term that came about that the Israelis were trying to use, Palestinian Hollywood. It's like Pallywood. There's no such thing as Pallywood in Palestine. You can go there and take a picture or a video of a kid blown up, and that's a real video. I think justice needs to be served, right? No atrocity should go without the people responsible for it being taken account for. And I think that's the next step. I think, yes, the ceasefire was good, but there needs to be a real ceasefire, there needs to be real aid, and there needs to be real justice. The UN Security Council showed how much of a joke they were, right? And to regain trust in the international community, they really have to, do what they need to do with the International Court of Justice, with the ICC, the ICJ, International Criminal Court, by actually prosecuting these criminals. We need to push for our politicians to stop taking money from AIPAC and taking all our tax money and sending it over to a different country. And we need to actually be America first. Whether you're Republican or Democratic, we can still be America first. Like, we don't need to spend all our money abroad while we have our fellow Americans not being able to afford groceries, milk, not being able to afford healthcare. I mean, I'm a doctor. I can tell you how many patients have difficulty with insurance payments, right? And yet we're talking about sending $15 billion to Israel this year, of which majority of it is military spending, of which all of it went to genocide. I mean, I think it's pretty amazing to see the youth in the world, and specifically in America, realizing that what's happening in Israel towards Gaza and Palestine is wrong, and you're seeing public opinion shifting at a rate that none of us would have ever imagined. I started this conversation off saying I was raised in the 9/11 generation, and we were told to shut up and be quiet by our relatives so that we don't get any in trouble for just being normal human beings. And now we're coming to a time where the youth is super vocal, super loud, using their social media platforms for good. And it's really a bright moment in the future. And I think even the Gazans, when I was there, the Palestinians appreciated that. I don't think they see America as a savior, but they were like, the fact that Mamdani won in New York City without Israeli money is a victory. And they were very happy about that. They don't care about which side of the aisle you're on, right? They just wonder why, as an American politician, you have to say, I will visit Israel if I win. It's logic that someone who was voted for New York City should be taking care of New York City. So my point of bringing that up is even the Gazans brought that up to me. They're like, what do you think about this? And I said, I don't really know what to think, but the fact that he didn't take AIPAC money is pretty amazing. I have colleagues at work who have never left the state of Wisconsin, who have no idea what's going on in Gaza because they watch Fox News and these propaganda channels that don't really show the reality. And I showed them pictures and stories from my own experience. They started crying. They're like, they are confused. They're like, wait, we're watching this, but you're telling us this is happening? Like, are you sure? I'm like, I'm sure. You can look through my phone and look at all the pictures and videos you want. And they're in shock to the point people I work with are literally telling me they're crying at home. You know, and I had another person that I talked to say that she went home and talked to her husband and family about it at dinner to explain the situation. And I think this is what we can do, right? We can just talk to our little circle of people. I'm not anyone famous. I'm gonna just talk to who I can at work, in my society. And slowly, the truth cannot be stopped, right? You speak the truth and that truth will spread. The moment you're considered a liar, no one's gonna trust you anymore, right? And I've been public about everything I said. If anyone has found a lie in what I'm saying, it'll be caught. But the problem is, too many doctors and nurses are saying the same thing, right? It's consensus at this point. It's fact at this point. And even if we said nothing, the people in Gaza have been screaming it on social media, but for some reason the world ignores them, right? So that's what I'm saying. We have to be the voice for the voiceless, and we have to remind people that the Palestinians are humans, and they're fighting for their land.